Hey, what's poppin'? Is it your jaw? Great. Today we're talking about temporomandibular joints, TMJ for short, and temporomandibular dysfunction or disorders, TMD for short. Hi, I'm Dr. Zach Ratliff at TruMotion Therapy here in Charlotte, North Carolina, where we specialize in musculoskeletal pain and injuries. And one of those that people often don't think we treat is TMD, or disorders of the temporomandibular joints. So let's start this conversation talking about the anatomy involved. So we have the joints, we have the TMJs on either side. Those joints are connected by a single bone, the jawbone or the mandible. So all of that, pretty simple, clear. But then the inherent issues arise when we talk about the disorders and dysfunctions. So the issues arise when we have two joints, two moving pieces, but one common piece in the middle. So if those joints get out of sync or out of rhythm with one another, it's going to bias that jawbone one way or another. So one of the common issues that happens is that one of those TMJs opens less and slower. And now when, say, this one opens slower, it's going to cause the jaw to deviate toward that side, and then typically it will catch back up when we're at full mouth opening. Now, the issue here is that it's a group project gone wrong. One joint is moving too much and the other joint isn't moving enough. This can cause muscular imbalances, capsular stiffness in those joints. And the common symptoms that come from TMD or issues with the TMJ is jaw pain, of course, as the primary, but then we can also have ear pain. We can have tinnitus or ringing in the ears, along with headaches or neck pain. So these two little joints can cause issues that seem way beyond them. So now that we understand a little bit more of the structure of these joints, let's talk about some of the things that cause the issues. Now, commonly, this is going to be related to postural stresses. So this is where it kind of pulls in the neck and headache-like symptoms. So oftentimes we're sitting in front of a computer screen or locked into an activity and we start to lead with our chin. So whenever that happens, all these muscles on the back of the neck are going to go into overdrive. Some of the ones on the front are going to clench in, and that's going to cause some imbalances. It's going to put more workload on certain areas, and those TMJs are going to be one of the areas that that extra stress lands. Now, this brings us to the other point. Another factor in these issues is going to be stress and anxiety, which can lead to clenching. So when we get stressed, we tend to let our shoulders drift up toward our ears and we become a ball of tension. Now, those things are also going to make our jaw clench and we might even grind our teeth. Now, obviously that's going to aggravate the jaw as it's getting compressed. It would be easy enough if the stress just went away, the tension left it, but we oftentimes hold on to a lot of residual tension and we're clenching even when we don't realize it. So oftentimes this even carries into our sleeping habits. We're clenching all night long, so then you wake up in the morning and you feel a lot of pain, tension, or even lack of range of motion in your jaw. Now, the good news is there are plenty of conservative options to combat TMD or the pain associated with the TMJ. Now, a lot of this is going to be about changing habits. So commonly gum chewing or only chewing food on one side of the mouth, or the stress, anxiety, all of those things that contribute to that clenching of the jaw are going to be habits that we need to mediate or manage our stress accordingly. Now, other factors of this are going to be increasing the mobility in our mid-back, because if our mid-back can stand taller, our neck is going to naturally fall back a little bit further, and it's going to take some stress off of those TMJs. Now, from our perspective in the clinic, this is something we're often using dry needling, other muscle work, our laser therapy, along with mobility work, which could include rehab exercises. It could also look like adjustments. So there are plenty of conservative options in this realm. So if this does sound like something that you're dealing with, and oftentimes this can be a chronic issue that people deal with, so please let somebody help you deal with this. We would love to invite you to check out our website at TruMotionTherapy.com, where we have more resources, more videos, as well as the ability to schedule an appointment with one of our providers. And we would love to get that pain knocked down, help you on this journey, and get you back doing all the things that you love.